My name is Dr. Gregory James Hummer. I'm a trained trauma surgeon and the CEO of Simplicity Health Plans. In this segment, we're going to be looking at ways to solve the problem of increasing health insurance and the problems that are associated with coverage. Stay tuned for further segments on how Simplicity Health Plans can play a role in this. Thank you very much.
There have been, and continue to be, so many serious problems with the traditional health insurance system that the true consumers of healthcare, the employee and the employer, have had to bear the burden of financing a wrecked system. In an attempt to alleviate some of the burdens on employees and employers, and to return free market buying power, called consumerism, to Americans, the federal government enacted two health care insurance reforms through legislation: medical savings accounts, better known as MSAs, and flexible spending accounts, better known as FSAs. These programs could provide you with the freedom to choose where your health care dollars could be spent, like a cafeteria plan. But your saved dollars were lost at the end of each calendar year. And maybe you didn't know this, but the lost money either had to be donated to a charity or turned over to the administrator of the plan to apply towards the cost of administering the program. In other words, someone else got your hard-earned savings. If you didn't use them, you would lose them. That just wasn't fair enough. So, using FSAs and MSAs as a stepping stone, a chief economist for the American Medical Association by the name of Jesse Hickson came up with the idea to offer the public a plan called a health savings account, or an HSA, with a high-deductible health plan also known as an HDHP, the initials of high-deductible health plan. The concept was transformed into reality when Dr. John C. Goodman, an economist and the president of the Dallas-based National Center for Policy Analysis, took steps to promote the idea of HSAs and to get some successful testing accomplished. After much debate, testing, and lobbying by Dr. Goodman and others who were dedicated to the implementation of the high-deductible health plan with a health savings account, the government finally established the HDHP HSA program under the Medicare bill signed into law by President George W. Bush on December 8, 2003. The basic goals of an HSA plan are the following. 1. To give you control over your own money, because you will be much more judicious in how you spend it. 2. To give you control over your own money to spend it as you see fit, with certain guidelines established by the government for qualified medical expenses. And with that power, you will find the best service at the best price. 3. Give the vast majority of people in the United States the opportunity to save their health care dollars with tax-free interest if you don't need or want to spend your savings. After all, as we said before, 83% of us spend less than $700 per year on medical expenses. Number 4. Give everyone the same opportunity to set aside the same amount of money for one's health care, either through tax-deferred payroll deductions or with one's own personal deposits from other sources. Number 5. To give you tax breaks on your savings for qualified medical expenses. But if you have to use your money for some other critical reason, then you can withdraw it with a 10% penalty. 6. To let you accumulate your unused savings in a bank account, tax-free, with interest, until retirement age, when you can withdraw your savings for any reason, without penalty, at a tax rate you enjoyed during your retirement years, which is usually less than the rate during your working years. Number 7. Cap the maximum amount of money you have to spend out of your own pocket, so your finances are not broken or bankrupted by medical bills. Number 8. To give you back the responsibility for your own health care with your provider, so the high costs associated with managed care organizations will decrease. Number 9. to develop a health insurance system so that if you have chronic illnesses, you'll probably pay no more and perhaps less for medical expenses than you did under a traditional health insurance plan. Number 10, support you in case of a catastrophic health event in your life with a high-deductible health plan with catastrophic coverage. In other words, the concept behind the Medicare Health Savings Account legislation recognizes that for the majority of your expenses, you should not have to pay for everyone else's problems in one big pool of patients. Finally, the government recognizes that you are an individual and that you are entitled to your money apart from the crowd. You're entitled to spend it on your health or save it as you see fit. The legislation also gives you the decision-making authority over the use of your money for your own personal health choices. Finally, and this is very important, the legislation gives you tax breaks as an encouragement for you to save money in a nest egg for your retirement.
Thank you for watching this segment. Be sure to tune in to the next clip.